It really is the same thing that it is with influenza. So it's a droplet-borne disease, so cough etiquette, sneezing etiquette, sneezing in your sleeve, critically important. And then the environmental cleaning as well, hand hygiene, again, it's been proven time and time again, hand hygiene, soap and water for at least 20 seconds, and be meticulous with that anytime you come inside from being outside before you eat. Limiting contact right now. I'm glad to see that at Union Health, as I travel around, I'm seeing a lot of elbow bumps when people, in place of the traditional handshake, we're seeing elbow bumps, which is great. And so it is being very mindful of your distance to people. We've all heard of the 6 feet, and that very well holds true. Again, because it's a droplet-borne disease. If it's not airborne, so it's not a factor of breathing the air that somebody with the disease is breathing, it needs to be droplets. So if you can keep your distance, and if you do have signs and symptoms, if you have a fever, go home. If you have the respiratory, the shortness of breath, the dry cough, go home. Keep away. That's going to be the biggest factor to help us get through this. So if it is those respiratory symptoms that we talk about or other symptoms of a viral illness, we have the COVID hotline now, and you can always call that to help get some guidance. But I would caution the public of reflexively going to your doctor's office or just presenting to the ED, to the desk of the convenient care, because the reality of it is, even if it is a viral illness, if it's a mild illness, A, there's no treatment, and B, they're just going to tell you to go home anyway. So chicken soup and Tylenol is what we've been telling people, and if that's the case, that can be done over the phone, in consultation with your provider, with clinicians at the COVID hotline, etc. So a phone call before the risk of transmitting the disease is absolutely recommended. We're in very close contact with the State Department of Health and the CDC. The recommendation right now, there is a caution against testing because of the limited supply. So right now at Union Hospital, as of Friday, March 20th, the testing is really reserved for hospitalized patients that have the symptomatology of a viral illness, along with maybe comorbidities, the fever, maybe in the elderly as well. We do know that the elderly, those that are immunocompromised, those are the ones those patients have the poorer outcomes. And so we're really reserving the testing for that. For the younger population, those are mildly ill. There's not a great deal of value in testing it in the circumstances of a limited supply, because the result's not going to matter a whole lot. It's going to be go home and social distance yourself for that period of time. The Indiana State Department of Health is doing a great job of keeping the most current documents online. That and the CDC as well. Those would absolutely be my recommendations for the most current. It is incredibly dynamic, and sometimes we're battling a couple times a day changes, but it would be those websites that I would refer to for the best, most current recommendations.